I was probably about 13 when I started, considering having surgery to correct my breasts.
Now just 16.
What is your understanding of why you are here today?
It's to have breast augmentation.
Okay.
Haley is about to do it.
I'm going to turn you over to Dr. Damascus then, okay?
Haley was concerned about the fact that she was small on both sides. There was some asymmetry, but fairly minimal.
But the asymmetry was a lot more than just fairly minimal to Haley.
When I looked at myself, because I was not symmetrical, I felt that I was abnormal, because I looked at myself and I saw that I was deformed.
Deformed?
Deformed.
That's a very strong word.
Yes, but I feel that it's very fit to the way that I looked.
This is how Haley looked before her surgery.
This picture is from when we went to Hawaii.
This is you?
Mm-hmm.
Mm-hmm. Haley, you look totally normal in that picture.
I don't think so.
This is a child who's a straight-A student, who's an athlete, who is well-liked.
Haley's mother, Chris.
She could not stand in front of a mirror without a towel on because in her eyes she felt deformed.
You know, a lot of women have breasts that are not the same size.
We repeatedly conveyed that
What
to
did
her.
you say?
No, I would say, Haley, no one is perfect. No one is perfect. Women have different breast sizes. However, in her mind, she didn't see that. She did not see the girl next to her with 1A and 1B.
The definition of deformity apparently has expanded so that many people, many parents, and certainly many teenagers feel anything that's not perfect is a deformity.
Psychologist Lily Friedland worries about kids seeing surgery as a quick fix for what may not really even be a problem.
It's a question of, is this person mature enough to make a decision that's a lifetime decision oftentimes?
I would not consider doing breast augmentation on anyone under the age of 18.
Beverly Hills plastic surgeon Dr. Harry Glassman.
I don't think that a 16 or a 17-year-old, with rare exception, is emotionally prepared to make a decision such as that. I think of this as being a haircut, and it's not.
Dr. Glassman has medical concerns as well.
Why would we operate on breast before age 18? Because we know that the breast can continue to develop between 16 and 18.
I agree. It is a very serious procedure. Looking good is still even better than feeling good to them.
So you tell them the risks and they just shrug it off?
In most cases.
Dr. Damascus sees those shrugs coming from younger patients all the time.
How young is the youngest patient that you've done this sort of surgery on?
In liposuction, the youngest probably has been around 14, actually.
14?
Yes.
Well, what's the underlying message to the teenager?
Put your best face forward, and then on the other hand to say your best face isn't good enough.
Unfortunately, a teenage girl's life almost every day is like a walking Miss America contest.
Teenagers have always had difficult problems. It doesn't necessarily mean that we should employ technology in order to try to make their world perfect.